So Rory McNeil from RSpace, and I'd just like to put in a plug for Boston, because I moved to Cambridge actually, but we'll call it Boston for now, about a year ago from Edinburgh in Scotland. And as you're going to see, our software is used in managing biomedical research data. So I came, this is my pilgrimage to this Mecca, the World Center of Biomedical Research. And I've been coming to some of the Boston New Tech events since I came a year ago, and I'm delighted to be speaking. And I feel now like I'm really a part of the community. So it's a great place, and thanks for having me. So our software is a sophisticated enterprise software. So it's not an app. It's not something that you can just kind of demo in 5 seconds. So I'm not going to be able to show you the whole product. You can see here what we call the workspace. And what I'm going to do is actually do a little presentation inside the product to show you some of the capabilities of the product. So here we go. So what's the problem? The problem is that there is an extraordinary amount of biomedical research done, and most of it is actually rubbish. I was at a presentation by Johnson & Johnson last week, and it turns out that some studies were done, and of the life sciences research done in universities, the studies were only able to reproduce 12% of the results. So that's a pretty low percentage. And it's not just, it's better in industry, but not that much better. So there's a huge problem with the quality of data in biomedical research, which costs a lot of money. So our solution is RSpace, and the quickest way to explain it is Google Docs for life sciences. So it's kind of like Google Docs for those of you, which I assume is most of you, who know that's a collaborative software. And it's tailored for the kind of things that biomedical researchers do at the individual level, at the lab level, and it's also an enterprise product that can be deployed throughout, for example, a whole university or medical school. So what is it? That's one way to think about it. It's a digital research platform that enables convenient, secure, compliant recording and sharing of research data within and between organizations like biotech companies, contract research organizations, pharmaceutical companies, colleges and universities, and venture foundries like Third Rock and Flagship here in Boston. So our USP, all products need to be usable, or people won't use them. They need to be scalable, and they need to be affordable if you want to get mass adoption, which is what we're aiming to do. Our product is the only product that's adopted what we call a connected approach, because we enable connecting of what's the data that's in the electronic lab notebook to data that's held externally, the tools that people use in their research, and also to data repositories. So it's meant to, and it does fit in with the entire research infrastructure that people are using. So it's not an isolated tool, it's integrated in. So here's, to end up, here's a couple of screenshots. So you can see where we were previously. It gives you a workspace where you can collect your documents. There's also a file store where you can, it's kind of like what's on your computer. You can put in images, you can put in all sorts of different kinds of files, and you can drop files into your documents. You can create structured documents so that you can have a workflow. If you want your lab to be following a workflow, each document gets a unique ID, which you can see here, and it collects lots of information, lots of metadata about the document, which can be useful to you, and also can be exported into other systems so that the provenance of the research that you've done can be maintained. 8 seconds left, so that's about right. So I won't even say it's an overview of the product, but maybe it gives you a flavor of the product. So thanks very much, and happy to answer questions. Yes?
So what's the secret sauce that makes it different, better than Google Docs or SharePoint or any of the other?
Well, the two things that make it different from Google and SharePoint are the fact that it's optimized for scientific context in two senses. So first of all, for example, the roles, there's a principal investigator role, a lab admin role, so it reflects the role of the lab. And secondly, and Google Docs is not actually an enterprise product,
Right.
but this can be deployed for hundreds of labs across an entire institution. So that's what differentiates it from the likes of Google Docs. What differentiates it from other products of this category is the connectedness that I mentioned, the ability to link out to other data sources. If you have sequencing data, if you have 50 terabytes of sequencing data,
Sure.
you don't want to bring that into the notebook, but it's very handy to be able to associate the write-up of your research with your raw data, and then actually, believe it or not, none of the other products facilitate that.
Cloud-based?
We deploy either cloud or on-prem. It's up to the customer.
What does your pricing model look like?
Pricing model is, because we want it to be used as a mass product, so the pricing model is $100 per user per year in academic context and $200 in commercial context.
Can more than one researcher be working on the document? So like Google Docs, how it has that sharing mechanism where more than one person can be working on a document. Does this have that ability? So if there's more than one researcher working in a certain area, maybe even if it's across labs in the field or whatever.
Yes, I mean, multiple people can access a document, has sharing, so different people can, it depends so yes, if different people have edit permission for the same document, they can all work on the same document. Not at the same time, but if you and I are both working on a document, if I'm working on it, I send you a message that says that I can transfer over to you. We don't have simultaneous editing because that actually interferes with the protection of intellectual property, because we need to keep a version of who's done what when. So that's in a way, another example of how it's tailored for scientific contexts.
Just as a follow-up to that question, does it keep a history of the edits made to?
Absolutely, it keeps a full audit trail of who did what when, so it's fully 21 CFR 11 compliant.
And
Yes.
can you go back to an older version?
Yes, you can restore older versions, and yeah.
So you said that it's role-based. Does that transfer across your different scientific disciplines, or do you have to customize it for different customers?
It's basically used in life sciences research, which means biology and chemistry. So the lab, the wet lab is the metaphor, if you will. So there's a principal investigator role, there's a lab admin role. So the lab admin can actually take on the same function as the PI. If the PI wants them to, it's configurable. So in a way, the PI doesn't. It's the leader, if you will. So if it's not a lab group, then it is designed for lab groups. So for physics, for example, it doesn't really reflect the realities of physics, so it's not intended to.
So you're focusing on that.
On life sciences, yeah.
So, yeah, I have a question. So right
Just
now,
quickly, so you're out of time.
Oh, out of time. One last question?
oh,
Yeah.
okay. So what I wonder, right now it's functioning as a file management software system. Do you anticipate in the future sometime or building some kind of artificial intelligence? For example, you're talking about connect to the sequence data. In someday you might be able to tell, like when there's a mutation for that particular laboratory they're interested, be able to alert them there's some interest finding. So there's some kind of like down the road, because you're talking about specific for biological study this field. So that might be interesting to building that kind of capability into the system down the road too, I would think.
Yeah. Yes, absolutely. Yeah.
Summarize what the question was.
Oh, sorry. So the question was, would it be possible down the road to build in the ability to take in information about what's happening from files which are linked to? Is that right? Something like
Sure.
that? Yeah. And the answer is yes.
In my, yeah.
Thank you.
Great.
Thanks, Chris.
Thank you, RSpace.